So before we go any farther, I want to go ahead and tell a story. So at the Cedar Street Clinic, they have care teams, kind of the pod model made up of a MA, a front desk receptionist, an RN, and a provider. The different teams are designated by color. The yellow team is made up of Dr. Susan Mills, Sally, their RN, their MA, Gianna, and Joseph at front desk. One of the regular patients is George. George is homeless, living in an encampment by the bay. He is rarely able to bathe, and it's pretty noticeable. He's had past issues with getting clean and with substance abuse problems, but presently he's getting help from the local mission and doing quite well. Since getting clean, George has been friendly, but he is shy, and his appearance is unkempt and somewhat frightening to some people. George has an appointment that he made. He has a problem. He has something weird that showed up on the skin on his arm that he's very concerned about. As he approaches the front desk, Joseph, the receptionist, is finishing paperwork from the previous patient. As George gets to the window, Joseph looks up, wrinkles his nose a bit at the odor, and goes back to his paperwork without a word. As George starts to speak, Joseph holds up his hand, again without a word, and completes his paperwork. When he's done, he says, "Yes?" George says, I have an appointment. I sure hope it's not serious. It kind of hurts and it showed up. You'll have to tell that to the doctor. Wait over there, please, and points to an empty portion of the waiting room. Joseph then types a message on the office communicator to Gianna, the MA, saying, "Mr. Needs a Bath is here. He's already talking about pain. Good luck." Gianna comes to the waiting room to go ahead and pick up George. She doesn't offer to shake his hand or offer a greeting like, "How can we help you today?" Instead, she just says, "Come this way, please," and leads him down the hall. George tries to strike up a conversation, but Gianna is being a little reserved today and not saying very much. Before taking his vitals, Gianna puts on gloves but doesn't explain why. George shows her the problem with his arm and mentions that it hurts. "I imagine it does. Any medications for pain will have to be discussed with the doctor." "I'm kind of scared. What do you think it is?" "I don't know. The doctor will be in." She leaves the room, kind of glad to get out of there, and thinking, here we go, probably just wants pain medications. That doesn't look too bad to me. She lets Dr. Mills know that the patient is ready and expresses her thoughts about what she thinks is going on today. Dr. Mills enters the room without a knock or a greeting. "Let's see your arm." She appears reluctant to touch the patient even though she's wearing gloves. She doesn't ask him about his discomfort, doesn't give much eye contact, afraid it might take the conversation in a direction she doesn't want it to go, like pain medications. She just asks for a history. Her tone is very flat. When she's done, she writes up a prescription for the patient and hands it to him, saying, "Take these until they're gone." She doesn't explain much more than that. Still very worried, George asks, "But what is it? Will I be okay?" "It's an infection. Just take the medication until it's gone. As far as the pain goes, I suggest ibuprofen." She doesn't offer to write a prescription or suggest how much to take. Instead, and doesn't ask if he has any more questions. Instead, she just leaves the room. George sits for a while, and after a bit he shrugs and gets up, assuming that his appointment must be over. As George is walking down the hall, the clinic administrator sees George and comes up to him by name and asks how he's doing. George works up his courage and tells the administrator about his visit and about how it made him feel. Like I was some untouchable junkie. I didn't even want pain medications. I just wanted to know what it was and if I was going to be okay. The clinic administrator, of course, is very concerned, and Paul calls on the team to talk to them about their communication with patients. So, what is it really all about? For those of you who've had extensive medical educations, I apologize to you, but healthcare is actually not about medicines. It's not about treatment modalities, diagnosis codes, x-rays, labs, or any of that. At its heart, medicine is about a relationship of trust. A relationship of trust. Now, why would I say that? Why would I say that healthcare is about trust? For some of you, that might be obvious, but for some of you, it might not. So let me give you an example. Hi there. Hey. If you give me $50 right now, I'm going to go downstairs and outside, and in the alley there's this guy. And in 15 minutes, I'm going to be back, and I'm going to give you $5,000. I'm willing to bet that nobody is reaching for their wallets right now. Why is that? Well, because you don't know me, and you don't have any reason to trust me, and that sounds kind of sketchy. That sounds kind of weird, doesn't it? Well, what does that have to do with healthcare? Well, let me give you another example. Hi there. We know that you feel fine and everything, but after doing some testing, it turns out that you're really sick. You actually have diabetes. And so even though you feel fine, we're going to need you to change a whole mess of things. First of all, when you get home from work, even though you're really tired, we need you to exercise. You need to exercise hard, like till you sweat, every day for like 30 minutes. And then on top of that, even though you feel fine right now, we need you to start taking this medication. After you start taking the medication, you're not going to feel fine. You're actually going to urinate a lot, and you're going to be uncomfortable, and it's going to cause all sorts of issues. But you need to do this because you're very sick. And also, the stuff that you eat, the food that you eat, it's all wrong. It's totally wrong. You need to really go back to ground one and just start over, and especially give up those foods that you really love, including the one that you love more than you love your own mom. Wow. That sounds really weird, right? Why would they do that? Because after all, do they know us? Do they trust us? And that sounds kind of sketchy, because here I am, I'm being told I'm sick, and I don't feel like I'm sick. I feel fine. And that's why we need them to trust them. The fact is that when patients engage with their own health care, when they are part of the team with us, when they are members of the care team with us, that's when they get better. Study after study has shown that engaged patients have better health outcomes. And we need to create that relationship of trust. We need them to come and trust us. Because after all, who's really taking care of them? How many hours a year do you think that the average person spends with us, with the care team? A lot of people throw numbers out there, but I can tell you, it's at the most 1 for a well patient, and at most 4 for a really sick patient, which means there's 8,750 odd hours a year they do not spend with us. So who's really taking care of their health care? They are. So we need to bring them in so they can be members of the team with us and take care of themselves, and so we can grow. So how do we create that relationship of trust? Well, the basis for it, the best basis for any relationship, is a feeling of mutual respect. After all, if you don't feel like I respect you, what kind of relationship are we going to have? None, right? If you can do it. So we need to find a way to have people feel respected when we engage with them. In the old days, we used to say that we treat them the way that we want to be treated. But today what we actually say is that we treat them the way they want to be treated, the way that they understand to be respectful treatment. Because the fact is, if I'm a white Anglo-Saxon Protestant female from the East Coast, or an African-American gentleman from Missouri, or a Latin-speaking person from South America who just arrived, or an Urdu-speaking person from Pakistan, or an Inuit from Alaska, or a guy who just got out after 10 years in federal prison, we all have pretty different ideas of what respectful treatment is. So it behooves us to both become culturally aware and to do the best we can to know the community in which we serve, and also to become skilled in knowing when we're engaging and connecting with people and when we're not, and being able to do something about that. It's a good reminder that it does not matter a person's age, race, gender, sexual orientation, ethnic background, religion, social class, or politics. No one anywhere in the world should care about that stuff. But definitely here at Open Door, it is a matter of policy, and it is also a matter of law, that we cannot look at those things. A person is a person. Many of those things that I just mentioned, we already know not to talk to people about even when they love us very much, like religion or politics. That's a great way to start a fight at the dinner table. So we want to move beyond that and see people for who they truly are and meet them on their own ground. And remember that you might be the only chance, the only opportunity that person really has to know what Open Door is about and what you're really about. So this talk about feelings, about how patients feel, and about the engagement in that respect, that actually is really a big part of the way that the world is today. Who actually out there, before they go to a new place or to a new movie or something else, actually goes online and checks on Yelp or checks on Twitter or talks to their friends or engages on Facebook to find out about it? More and more people are aware of the choices they have out there, and even if they're with a place and they like doing business with them and they're happy with them, they still look around to see if they can get something better. That increase in awareness is really about the way that people feel when they're served. People are often concerned more or just as much with how services make them feel as they are with the actual results. A person has to actually feel respected for that relationship of trust to happen. This focus on feelings is what we call the patient experience. And really, the key part of the patient experience, it's part of what they call the triple aim. For those of you who haven't actually gotten the memo, American healthcare is broken. We are twice as expensive to 8 times as expensive as the next most costly country in the world for doing healthcare. So we're paying twice as much or more than everyone else. And out of 27 industrialized nations, we're number 27 in health outcomes. We're paying way more money, and we're not getting that bang for our buck. And so the solution for that that's been proposed, one that's been shown to work wherever it's been applied, is the triple aim. And the triple aim is this: improved patient health outcomes, lower cost, and improved patient experience. Now that sounds a little weird. How can we improve how healthy people are and lower the cost and improve the experience they have all at the same time? Well, the key to that, the key that makes the triple aim work, is actually the patient experience. When patients have the experience of being respected and having power in their healthcare and being members of the team, they engage. And what happens then is their healthcare gets better, and when their healthcare gets better, cost goes down. And so we really want to help people have that good experience with us. And one of the keys to that is making a good first impression, not only the first time, but every time. And there's some basic tools, things that we use all the time, things that most of us know about and think about, but we want to put them together here that can be really helpful in doing that. First and foremost, a smile. Smiles are powerful. Smiles are engaging. Every person who is seeing this training right now, all of us have had one of those times where we have been really down in life and someone, maybe even a perfect stranger, smiled at us and it made it bearable. Many of the people coming to us are not coming to us because it's their best day or because they're happy or because things are going well. They're coming to us very often when they're scared or uncertain or frightened or ill. And smiles can do a lot. A smile can also be a powerful tool when dealing with somebody who's really angry and upset. They know you see them coming and how they're looking and you're all, "Hi there, how can I help you today?" A lot of folks don't know what to do with it. It often brings them down and makes them realize that we're not the enemy, that we're willing to engage and help them when they're upset or angry with something. Another thing that's really important is eye contact, giving direct eye contact. Hopefully whenever you present and you talk to people, you get that. It shows that you're engaged, that you're with them and everything. Most of the time, eye contact is good. There are times where eye contact is not appropriate. For patients with autism, for example, one of the hallmarks of that disease is they cannot do direct eye contact. You'll make folks buggy inside of about 5 seconds if you try to get it. Additionally, for some cultures, direct eye contact is not okay. In our local Native American culture here within our area, direct eye contact is often considered impolite, and very often business is carried on without anyone giving that directly to each other. Additionally, if you have a person who just got out of men's prison, direct eye contact is actually how you start a fight. So you have to do the duck and weave to try to get eye contact from people. Don't worry about it. They know that you're interested, and there's other ways we can show people that we're engaged. On top of that is our enthusiasm, our greeting, showing interest, engaging people. What am I talking about here? "Hi there, my name's Thomas. Welcome to Open Door. How can I help you today?" As opposed to, "Hi there, my name is Thomas. Welcome to Open Door. How can I help you today?" Exact same words in very different experience because of the way that I carried it across and presented that with the enthusiasm that I give or don't give to it. Additionally, active listening, really hearing and communicating. This is a really key thing, and we'll talk about it more, but the most important part of this to understand is about listening. Despite what people believe, human minds cannot multitask. Neurologists have proved it. All we do is jump around really quickly and lower the quality of what we do. So the key piece here is if you are sitting there thinking of the wonderful, incredible, empathetic, helpful, kind, and knowledgeable thing that you're going to say to someone when they're done talking, you're not listening to them anymore. 80% of the formal complaints that we get at Open Door, where a patient has felt the need to go ahead and document their unhappiness and discomfort with our care, 80% of them are, they weren't listening to me. There may have been something else they were initially upset about, but it was when they perceived that they weren't being heard, that we weren't giving credence to what they need, that's when they decided to complain. Also, compassion. I think we all get that healthcare is a compassion business. I think most of us are here because we're driven by a desire to help our fellow human beings, to find work that's meaningful and that offers something to folks. And compassion can be really easy when people are nice and they're grateful and they're wonderful and kind. But we have many people who come to us and they're going to challenge our ability to be compassionate. We have folks that have behavioral health disorders and mental health disorders who often don't have much control over their behavior, people who weren't raised to understand how polite communication goes across or how to show gratitude, or they're just plain sick and scared. And so when I find myself challenged to be compassionate with people, one of the things that I find incredibly helpful is to ask myself a question, and you can all ask yourselves this too. Maybe we can raise hands. Who here has ever, when they were upset or angry or scared, done or said something that they later wish they had not done or said. It's good for me to remember that and to think that the person I'm dealing with right now, maybe today is their day, that they're doing something that they later will wish they had not done or said. When people forgive me and work with me and are compassionate towards me under those circumstances, I'm always appreciative, and we need to be able to give that same compassion to others. Does that mean that we need to take abusive treatment or be disrespected or to feel afraid on the job? And the answer is absolutely not. That is why your site administrators, your clinic coordinators, your office managers, that's why we are here to support you and our patients in having good relationships together. Additionally, be on time and keep people informed. Being on time. Okay, I get that that sounds challenging. This is a doctor's office, right? We all know how hard that can really be. Stuff happens in the rooms. But the key piece here is not about whether we're going to be able to perfectly get them in at 11:15 for their 11:15 appointment. What it is, it's really about keeping people informed. Who here has ever gone to a waiting room at a doctor's office or a dentist's office or someplace similar, and they check you in, and then you sit there, and now you're 30 minutes past your appointment, and no one has even come to talk to you, and you start thinking, I wonder if they even know I'm here. I wonder if they forgot about me. People feel disempowered when we do that. We need to understand that folks are sitting there and thinking to themselves, man, I got to go pick up my kid. I got to get back to my job. But they're afraid to walk out, because if they do, they're sure that they'll walk out the door and 1 second later we'll come out looking for them and they're not there, and we're going to hold them accountable for that. It is really especially the job of our medical assistants and receptionists to work together as a team and keep patients informed. They understand it's a doctor's office. They understand that stuff may happen with patients before them, because stuff often happens with them too, and we spend more time with them. So we need to be allowed to go out and keep them informed and say, hey, something happened with the patient ahead of you. I don't have a room to put you in yet. Are you willing to wait? Or if not, we are glad to reschedule you to the soonest possible appointment. We want to be able to turn the power back over to them, and that's another key thing that we can do, is by giving people choices, we empower them. When we give them choices, we show them that it's their care. They are the ones who live with the consequences of the choices we offer them. They are the ones who have to live with the side effects of the medications or the financial cost of the treatment. So we need to show them it's their choice. And when we do that, we empower them, not only in their own health care, but in parts of their lives that we can never see. Choices can be really powerful. I'm connected in the community, and I have many people come back and tell me stories about, you know, when they showed me that I had choice in my healthcare, I started thinking about choices I had in other parts of my life. Like, maybe I don't have to go home to that guy who hits me every day. Maybe I don't have to keep working at that job where they never pay me overtime, but I don't get to go home and see my children. We can make a huge difference in people's lives by showing them that they have choices. Choices can also be a great tool when people are upset with us. When we offer them choices, they see that we're trying to work with them. So I can see that it's not going well with you and Dr. A. So here's what we could do. We could sit down and talk with Dr. A together and see if we can work it out. We could see if Dr. B over here is able to take you on, or maybe Open Door isn't where you want to do your health care. What would you like to do? And when we offer that choice to people, they suddenly begin to realize they have control within their own life, which is what we all want for ourselves. And it can be really powerful, because folks will look at those choices, and even if they don't like any of them, because it's their choice, they'll pick the one they can most live with, and then they'll own it and stand on it, because it was their choice, instead of us telling them what to do. Who here likes being told what to do? And that's been one of our other big challenges in American healthcare. For 100 years, we have told people how to live, how to act, what to do, and we have some of the sickest people in the developed world, because we're telling people what to do instead of asking them what they want to do and what they're willing to do. On top of that, closure. Don't leave folks hanging. This goes whether we're on a phone call or in the clinic. An example is, I can tell you how many times I've come into a clinic and I walk in the hallway and there's somebody doing this thing. It's like, hi there, how can I help you today? Yeah, everybody left the room and I don't know if my appointment's over. And they said something about lab, but is that today or do I come back for that? And if it's today, where is the lab? Because I don't know where that is. We're all moving along. We're trying to see a lot of people, but we need to work together as teams to ensure that we give that person that connection to the next step in their journey, whether that's back to the front desk to set up a future appointment, or to the lab to say, yep, that's everything today. Unless there's anything else we can do, we'll see you in 6 months. And so be willing to do that and engage with folks.